that you've given to God to even share with us. We pray even this second session is going to be very informative and it will be in a position to change our lives, Abba Father. And it is in Jesus' name do we pray and believe. Amen. Let me just do a brief introduction before Carol starts the session. Maybe for those who are not there in our first session, welcome back again and good afternoon. Welcome back to our monthly webinar series. It's such a joy to see this community coming together and being committed to learning, growing, and taking proactive steps toward healthier living. Thank you, everyone. Thank you so much. In our first session, we explored the powerful topic of emotional wellness. This was just understanding how our feelings, thoughts, and inner balance shape our health in ways we often overlook. Today, we are going to take another important steps forward, turning our attention to a condition that touches millions of lives worldwide, diabetes. This session is designed not just to provide information, but to offer hope, clarity, and practical strategies you can use to share with your loved ones. And guiding us through this journey is none other than our amazing Carol, your health coach. Carol's passion lies in equipping people with the knowledge and tools to prevent, manage, and even reverse lifestyle-related conditions through natural and holistic approaches. She has worked alongside so many people, empowering them to make choices that get to restore balance, vitality, and even confidence. So get ready for a very eye-opening session filled with insights, solutions, and even encouragement. Let's lean in and ask questions. And most importantly, be open to transformation during this session. And let's use our emojis to welcome Carol, your health coach. Karibu sana, Carol.
Thank you. I love this part of the emojis. It really makes me happy. So keep the emojis coming. Keep the emojis coming. Oh, nice. I love them. Since I learned about them, they just make me happy. The small things that make you happy. This is one of them. Thank you, Annie. And thank you all of you who are sending emojis. And thank you who are here. I was praying for my throat. I hope my throat is ready for another session. It seems when it is time to do these sessions, it is time to do these sessions. And I'm happy. Thank you so much for all the emojis. You're in a smart. Lillian, I had not seen that one. I'm glad to see we are still streaming in. I think Team Uganda, you are more than Kenyans. Ugandans, you're serious, eh? Salome, you are overworking over there. No, I love this. I'm happy to see Wambui, Virginia Njoroge, physiotherapist Peter Njoki, Nsima Rona, Mercy, Mary, Margaret Wambui, Margaret Mukima, Margaret Magi, Lydia Murithi, Lucy Mwaniki, Lilian Wambui, Keshi Chege, Kate Kirika, Jen Gishohi, Irene Imani, Helen Harriet, Grace R&B from Eldoret, Faith Mushiri, Elizabeth Gitau, Edna, Christine Muriuki, Christine Bundi, Brianna, you are here and now you are back. Welcome back. Betty, Anbui, Agnes Gidinji, Ruth Imbira, and myself. I'm happy to see. I have decided today I'm going to read your names out so that the world can know you're here. Thank you so much. As always, I hope you have your pen. I hope you have your notebook. I hope you have something to hydrate you. Previous session, I had plain water. previous session, I also had kombucha, but now I have taken too much kombucha. Now I can't, I'm even feeling a bit high. So right now I'm back with my hibiscus and purple tea. So this is what I'll be taking. I hope you have something to hydrate yourself. Hope you have a paper and a pen so that we can learn. We are here to learn together. For those who are meeting me for the first time, my name is Carol, your health coach, and thank you so much, Annie, for such an introduction. Thank you so much. God bless you. And I am a naturopathic and functional healthy life ambassador. I enjoy what I do so much. Like I enjoy learning and teaching. I enjoy teaching and learning. Um, just a simple way, like one of the simple things that we do in naturopathy. Before we came in, I noticed my lips were drying up. So I took this. So this is cactus water, which I had soaked cactus in water. And now I've put it in a spray bottle because my skin was misbehaving. It was dry and it had reacted to fabric softener. Now I was applying this. So sometimes what you think you need from the shop, you actually have it. So when we were starting this session, and Annie had already introduced me, what did I do? I just took this water and lubricated my lips. So my lips will also be well hydrated. So there's no limit into what nature can do. There's no limit at all. So that is naturopathic ways of life. So I not only teach about naturopathy and functional ways of life, I live, and proudly so. If today you decided to surprise me where I am, if today you decided to host me, I would be practicing 99% of what I talk about. I have seen the fruits of that. I was actually just looking at some medical records I have here that I took at site care in India on 1st of October 2024. And I was looking at this file and said, these are the fruits. I'm holding the fruits of choosing this kind of a lifestyle. I was doubting that I'm healthy in 2024 because I had gone through grief and that year was hard. So when I go through hard times, I add weight and I actually look bigger, but I'm not heavier. Whenever I'm going through a hard time, my weight doesn't really change on the scale. But people will tell you, you're looking big. I grow because of either the hormones or something. No, not or something. It's because of the hormones. I'll grow hippie. My breasts grow. I grow double chin and sometimes the belly fat. So 2024, I was really struggling and I was sure, those moments you have gone through a hard time, you even start calling diseases to yourself. And I was doubting that I'm healthy. I was doubting this kind of life. And why I'm starting this journey, this session with a story is because I want to humanize what we are learning. I want it to be as human as possible. So I was feeling, fatigued, tired, you trying massage, you trying this. Grief had really overwhelmed me. And 2014 October, I flew to India to Site Care Hospital. They are my friends. They know me. I've been there several times. So when I got there, met Dr. Prasad, and the team went to the naturopathic doctor. My friend, she's called, I can't remember how, I don't know how to pronounce her name, but yes. So, and then I told them, I'm here, I want to do a checkup from head to toe. And they asked me which exactly. Of course, it was also time for me to do the PET scan. I do PET scan because 2013 I had cervical cancer. I only do it once in like 7 years. I don't make it a tradition to do PET scan so often. So it was that time. It was the last time I was there, I think was around 2018. And so I told them I want to do a test. I was just feeling not myself. And the devil in me No, we are told we have the angels, the good angels, and the devil. The devil in me was lying to me that I could be sick, and because now I was feeling bigger and was not happy about myself, and I was not eating anything extra. It was just the amount of stress, the amount of grief that I was going through. Walked in and we did tests. So this file I'm holding here, we did um we did so many tests. Let me try and tell you what tests we did. So I paid here for, this is the invoice and the receipts. I did consultation. I did PET scan. I checked HB. I checked my blood. Yani, I was doubting myself. Back, I told them to repeat to check for me my blood type, my blood group. They checked this is the PET scan report. This is the PET scan report. Then there's the liver function, the kidney function, diabetes, hypertension, everything. And after 2 days, after I did all these tests, then I went home, came back. I went to where I was staying, came back 3 days when the results were ready. I even did HIV. I did all the tests. When I came back, I still remember the face of Dr. Prasad when he was looking at that computer. He would look, then look at me, look, and then look at me. Then he told me, "This is incredibly serious. You have absolutely no problem." And we laughed because we are friends. And they said, but Dr. Ari, did you expect me to be sick? He said, well, not that I was expecting, but this is incredibly awesome to see someone who is as healthy as you. And that was my time for God to remind me that I am getting the fruits of the kind of life that I have chosen. Not to say that because someone is sick, it's because they're not living a naturopathic way of life. It actually, it just came as a reminder. For those who were in our first session about emotional wellness, my emotions were very mixed up by the grief. And so the emotions were even showing me that I could be sick. I actually went to hospital because I thought I was sick, but I couldn't tell exactly where I was sick. And then most of us Africans, we have also forgotten that our genotype is created differently. Again, I'll tell you a story of how, for the longest time, the first few years of my coaching, my health coaching, I struggled with my body. And I used to say, I'm doing everything. I'm eating, if I eat wheat, my stomach reacts. If I eat junk food, my body reacts. My skin will flare up. I do exercise, but I was not looking skinny as I wanted. And I used to ask God, you called me to talk about health and you're not making me skinny. But God kept reminding me that my genotype as an African woman is different. So as long as I'm healthy and as long as I'm not overweight, like the weight I have is healthy, but I'm a curvaceous woman. So the more I tried to fight that, the more I was stopping myself from living this purpose. What am I saying? That I also struggle with self-sabotage. And beginning of this year, I wrote this book and finally shared a lot about how I have struggled through self-sabotage. So it doesn't make me, because I'm Carol, your health coach, it doesn't make me not a human. I am human. I have the struggles that you have. And so when we are doing these sessions are being done by a human who has chosen to live a healthy lifestyle, who have chosen to live naturopathic and functional ways of life. And we are learning together as humans. I don't sit on this side because I know it all. No, I keep learning. I keep learning, I keep practicing, and I keep seeing the fruits. And so that is why we make it a tradition of coming here with something to hydrate. The next few minutes or the next 1 hour that we'll be seated here learning, we will be hydrating ourselves, because we know as a naturopath, if you are not well hydrated, you will have consequences like headaches, you will have backaches, you will have stomach disorders, you will have so many other things. So we start with the natural things that God has given us, hydration. So that is why we do this. I am also very committed to sharing this information to the world and with the world, And also documenting. That is why we come with a paper and a pen for the sake of tomorrow, because you will, whatever you will write today, maybe 3 years later, or maybe 6 months down the line, you will be going through an emotional state, or you will be meet someone who will be needing some help, and you'll refer to that notebook, what we said. Because as African, we have lost the culture of documenting. That is why I started Institute of Functional and Naturopathic Health Practice, which is the major sponsor of this, who is the sponsor of these webinars. Institute of Functional and Naturopathic Health Practice is simply a space for people who are in different professions, different ways of life, different purposes, coming together to be reminded how to use natural things, the 12 circles of life, into creating a ripple effect in whatever field they are in, so that they can be able to impact. So we have a program called Naturopathic and Functional Healthy Life Ambassadorship. So we recruit ambassadors, we recruit people who would want to learn and impact lives in whatever space they are in, whether you're in the market, whether you're in the courtroom, whether you are in the classroom, whether you are in a hospital, wherever it is. As a healthy and as a naturopathic and healthy life ambassador, you impact lives in whatever place you are. So the Institute calls us to come together, create a community of people, of Africans, and hopefully even beyond Africa. However, my calling as at now is in Africa, so that we can come together, learn together, and then document. Because most of these things that we learn here, they are not new. You actually knew everything I'm going to teach you today. Everything we learn, you actually knew it. You just needed a reminder, or maybe a structure on how to practice. So today we are here to learn about diabetes in layman's language. Disclaimer for those who are coming in for the first time: I am not a medical doctor. I am not a medical doctor. I am just a researcher, someone who loves life, someone who lives that life, and someone who is very passionate about naturopathy and functional ways of life. I am a health coach. So what I do is I coach you, I show you the way, and then you choose whether you will go through the way or you will go through the other way. So it doesn't mean it, I don't use medical language so much. I do not fight with doctors. I allow the doctors who are open-minded to work alongside with me. I've seen physiotherapists here. So in conventional treatment, there are different types of therapies: physiotherapy, psychotherapy, radiotherapy, chemotherapy, those therapies. And so we work in conjunction together, so that we can come together and find a solution. So when we are here and we are about to talk about diabetes, now that is just a brief history to also let you humanize me. See not a perfect human being, but see someone who also goes through these struggles. I was born and raised in a family where my grandfather and my grandmother had diabetes. I was raised by a father who was diabetic from the age of 38, and he passed on at the age of 70. So he went through diabetes for how many years? Those years. I have interacted closely with people who have diabetes, and they have taught me quite a lot. And so that is why I'm very vocal about diabetes, because I have had firsthand I've been firsthand indirectly affected by diabetes, because I watched my own father go through all the stages of how messy diabetes can be. It's messy. It can be messy if it is allowed to keep progressing, if it is not taken good care of. I watched his eyes. It started with his eyes, his eyesight being messed up. He had several eye surgeries. One eye ended up just disappearing. I'm thinking in Kikuyu. I watched him in dialysis for 17 years, 17, 18 years. So I know what kidney failure looks like. I know the challenges that come with it as a primary caregiver. I watched his heart being, whew, yes. I watched literally his body die, and the best part, with the only part, the what we buried, I keep telling my siblings and my mom, the only parts we buried of my father are bones and skin, because the rest of the kidneys, the rest of the organs had already failed. The liver failed, kidneys failed. The last few months, the brain was damaged, the heart was enlarged, and I've seen firsthand what damage diabetes can do. At the same time, in the same family, I've been brought up by some uncles who I have watched reverse diabetes, my dad's brothers. I've also watched so many people who have chosen to reverse diabetes. So when I'm speaking about diabetes, I'm speaking from a part of me that is very raw and very a part of me. So I have seen both sides of diabetes. And I would want to share from experience, from personal experience, and from the research that I have been doing on few nuggets in layman's language and in naturopathic and functional ways of life, how we can be able to prevent ourselves from getting the diabetes, or if we already have it in our bodies, then how do we do that? First of all, we are all candidates of diabetes. I wrote something, allow me to read. I rarely read, but this one I felt I needed to write it as I was inspired. I tried defining diabetes in layman's language. So this is what I wrote. Diabetes is a health condition where your body can't properly use sugar from the foods you normally eat. So when I talk about sugar, don't see the table sugar, the sugar that you add to tea. I will explain the sugar. Normally, a hormone called insulin helps move sugar from the blood into the body's cells for energy. In diabetes, either the body doesn't make enough insulin or the insulin doesn't work well, so sugar builds up in the blood instead of being used up as energy. Over time, this can cause problems for the heart, the kidneys, the eyes, the nerves. Oh, yeah, I forgot that my dad's nerves function, I think by 2007, they were 85% dead. Yes. So I was trying to really summarize it. Then I tried to summarize it in a naturopathic language. So listen and see if you can get what I was trying to write. Diabetes now in a naturopathic language. Diabetes is a chronic metabolic condition in which the body has difficulty regulating blood glucose, in quote, sugar levels, due to either insufficient insulin production, impaired insulin function, or both. From a naturopathic perspective, it is seen not just as blood sugar disorder, but as a whole body imbalance influenced by diet, lifestyle, stress, toxicity, and maybe a small part genetic predisposition. Naturopathy, in naturopathy, we emphasize on identifying the root causes. So for the root causes for diabetes, some of them are inflammation, nutrient deficiency, hormonal dysregulation, and such. And then in naturopathy, when we identify the root cause, we support the body to initiate its own ability to heal through nutrition, primary foods, rest, exercise, stress management, herbal medicine, and lifestyle modification. And that is why we are having these sessions. And one of the sessions we had earlier in the morning was about emotional wellness, because we all know that diabetes is a lifestyle disease. And when there is excess stress, it actually triggers the diabetes, because remember, we are all candidates of diabetes because it's a lifestyle disease and we are in this lifestyle. And when we talk about lifestyle, we not only talk about diet. Most people only think about diet. But from today, from this session, let us see the word lifestyle. Allow me to take some water. Every time you hear the word lifestyle, I want you to start separating it from diet only, not separating it, but stop seeing it as lifestyle is equal to diet. No, lifestyle is equal and it is greater than, yeah, lifestyle is greater than diet. Lifestyle is greater than rest. So it has several things. Let us look at some of the things that would actually trigger lifestyle changes that would actually trigger for you to have diabetes. The first one is diet. Now we have talked about the diet. The second one is if you lack rest, you are always moving up and down. If you lack rest, you can trigger diabetes. If you're the kind of a person who never rests, you are always up and down, you are overwhelmed, you are frustrated, you are doing this, that, and that. You never rest. Lifestyle is greater than the stress management, the emotional wellness. How is your emotion? How are you managing the emotions? Your attitude, your perspective, perspectives. How do you handle when things are difficult? Do you have shock absorbers? As we continue, kindly, if you're a member of R&B team, come to the chat box, write your name, your location, and your branch and your phone number. Kindly identify yourself on the chat box, and I'll tell you why I'm saying this. The fourth one is you need lifestyle is greater than the environment that you're living in. You need to look at the home environment, the work environment. Some people are in very toxic work environments that will trigger diabetes. Some people are in very toxic home and relationships environment that will trigger diabetes. Some people are living in a space where the environmental condition is so polluted. The air is polluted. There are so many chemicals. There's the environmental, there's the home environment, and then there is the work environment. Some people are just stressed because they also have not found their purpose to a point they get diabetes. So when we're talking about lifestyle, I want you to not look at just the eating. I mean, the diet. Remember, also lifestyle includes even the mobility. How are you moving? Are you moving, or are you just seated? You don't even do exercise. Some people they will say, I don't have weight, so I don't need to exercise. No, you don't exercise for weight. We exercise for several things. To wake up the lymphatic system and remind it to help it be able to move. What does the lymphatic system do? The lymphatic system is seated or is paired by the circulatory system by God. God created the lymphatic system to draw all the toxins from the blood and be able to help you remove. How do we remove? By moving it to the lymph nodes. After the lymph nodes receive, then they know how to remove those toxins through sweat and through urine. So you also need to you exercise to open up the lymphatic system, to activate the lymphatic system. So you don't exercise because you're overweight or because of any of such. We also exercise so that we can have oxygen in our muscles, in our tissues, in our ligaments. We can vibrate our muscles so that we can have proper communication and even the nutrients communication, nutrients absorption and such. We also exercise so that we can release the mental, you know, for mental wellness. When you're doing some exercise, when you're doing a walk, when you're breathing in and out, when you're doing your yoga, when you're going to the gym, when you're doing all these things, you are helping the mind to relax. We also exercise so that we can help in communication of the hormones, for the thyroid to be able to communicate well with the pituitary gland, with the hypothalamus, with the liver. All these things need exercise so that you can be able to promote a proper communication within our blood. So if you're just seated throughout, you sit in the office, you drive again to home. When you get home, you sit on the couch and your work is to watch television, and maybe you just go and just sleep. So exercise is not just specifically because it's not because you are overweight. So those are some of the lifestyle issues. Okay, the other things that I can talk about lifestyle that can trigger you to have diabetes is your mental state. So there is the emotional state and there's the mental state. The mental state is, There are those people who naturally have anxiety. They naturally are scared of not good enough. They are scared of this. What is the mental state? The other thing that can affect and even cause you to have diabetes is the kind of medication that you're abusing. Maybe you're on certain, maybe not abusing, but maybe there are some certain medication that you're taking that can trigger the diabetes to be born. So there is a very big discussion that keeps going that because my father and my mother had diabetes, I will get it. As Carol, this I'm saying huu ni msimamo wa Carol. For those who don't understand Swahili, I'm saying this is my stand as Carol. I believe that diabetes is not fully genetical. That's what I think. I think and I believe that lifestyle diseases that we say that they run in the family, it is the lifestyle itself that runs in the family, the lifestyles that trigger those diseases. So it's not the disease that runs in the family. It is the lifestyles that trigger those diseases. Allow me to explain. I did my research and I needed to understand why and how my grandfather and my grandmother were both diabetic, yet I met my great-grandmother. The two met great-grandmother. One of the great-grandmothers she died when I was younger, so I didn't get to know this one. But the other one for my maternal great-grandmother, I met her and I actually took care of her until a day before she died. And she was very healthy. So I asked myself, if diabetes runs in the family, how come my grandfather and my grandmother had diabetes? So I went back to the history, and I am thankful because I was able to live with my grandfather for so many years. So he taught me so much. I learned so much, and I asked him so many questions. My grandfather and I were very good friends. We discussed how they used to do family planning as him and my grandmother. That's how much of friends we were. And I observed that they actually got diabetes because they went through a lot of stress during the fighting for independence. They were very young. Their family was beginning to be very young. They only had like 3 children. And there was a very big conflict around that time between the Christianity and the Mau Mau. There was the Mau Mau, there was the people who were receiving. So my grandfather, from choice, one, he had gone to school, unlike most of his age mates. And so when Christianity came, he chose Christianity. And so he was the quote unquote the enemy of the Mau Mau. So he was also among the men who were going to introduce Christianity to people, and he met a lot of hostility. He was telling me how he was the first person to teach people how to bury the dead. And they used to call him Mwalimu Gathikani, the teacher that buries. And so you can imagine the kind of hostility and the fear and anxiety they lived in as a young family. And that is what triggered the diabetes in the two of them. Unfortunately, my grandmother later, because it was cold, she had given birth to 11 children and such things. She got arthritis, and when she was going for surgery, they messed up with her spinal cord, and she had to sit on the wheelchair. So because of the fear and the worry and the anxiety around the independence period, guess what? These two parents ended up sharing these emotions or sending these emotions to their children. So most of their children, not all of them, some of their children got diabetic, got hypertensive, got so many other things to deal with. My father being one of them. My father was the firstborn. My father is the one who was around 10. I think he was around 10. So he watched this fear. He used to tell me horror stories. Some of those stories he hasn't even talked about them. He used to tell me those horror stories of those moments when he was that. So that explains that the lifestyle triggered the disease. It is not that the disease lives in the genetics, because how then did they have 11 children and some of them got and some of them didn't get? Are you getting my point? I am saying that is one of the many other things I have proved, that the lifestyle, you as a parent, if when you're stressed, you keep things to yourself. Remember, children watch. And children will treat themselves the way they watched you treat yourself when they grow up. The way you relate with stress today is how you saw your mother or your father deal with that stress. Unless if you called yourself for a meeting and said, this is a toxic way of dealing with stress, this is not going to yield fruits, and then you changed yourself from what you watched your parents go through. And so we want to sit back and blame it on the genetics. I don't dispute, maybe there's a 0.001% that will interfere with the genotype. But then I still think it is the attitude, the perspective, the way of life, the way we handle stress, the way we handle things, the art of not being able to learn to how to let go. Because remember, when you were born, you were put in a certain family, you were brought up with their own family rules or family ways of life. You were put in a certain church, so you were given those rules of that church, like you were modified. Remember, me and you, I'm a social my degree is on sociology, and so I am a social being who sees things from a sociology perspective. So you are the way you behave today, the way you handle your anger, the way you handle your bitterness, the way you handle your unforgiveness, it has been modified by your culture, by your religion, by your parents, by the family you were brought up in. Have you ever seen in your village when you say, a certain family, they get angry so easily, a certain family, they talk so badly, a certain family is very calm, a certain family is like this and this and this and that. So you were born, you were raised in the childhood, in the infancy, in childhood and adolescence, they molded you. When you become an adult, it's you who chooses how to live, what to take from what you've been taught, and what to keep to yourself, and what to let go and create new habits. That is why I still believe lifestyle diseases don't run in the family. Ways of life, attitudes, perspectives, and how we handle stress, how we handle things, that is what causes diseases in a family. I would want to hear what you think about that. Go to the comment section and share your thoughts. And every thought is allowed. You can say anything. Every thought is allowed, as long as you'll be respectful of the other person's perspective. Because remember, we all have different perspectives. That is my thought. So we have looked at some of the lifestyle things, lifestyle issues that can trigger the diabetes to become a disease. So there's diabetes type. There are two types of diabetes. There's the diabetes type 1 and diabetes type 2. So type 1, it's mostly it's the juvenile diabetes, where a child during the formation in the womb, maybe the mother was having her own health problems, maybe the mother was having her own mental problems, maybe the mother, there's something that happened, and maybe a part of, remember, even in medicine, they leave room for miracles, they leave room for the supernatural being. There are some things now, there's a small percentage that is above us, it is in a supernatural being, where we can't explain how a child's pancreas is born either overworking, underworking, or not working at all. So that is diabetes type 1, which affects mostly children. Some of them were born with it. Some of them, they develop it when they are younger. So as much as we are also talking about juvenile, the diabetes type 1, it also tells us that even this lifestyle issues that we are talking about, they also affect our children. We assume that children never get stressed. We assume that children don't have mental health, mental wellness. We assume that children don't have organs. But children as young as conception, I mean not conception, birth, they have organs, they have emotions. But even before birth, they have emotions. They have all these things and they are feeling it. So there is the person who was born with it, then there's a person who developed diabetes in between. So it's very important to assess, to also help this child, to assess this child together with them, because It could be a lifestyle issue. It could be a lifestyle issue. It could be, I've seen, I think the saddest part, the saddest case I've ever dealt with was a child who developed diabetes because their diet was bad, 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 bad. A child who was 9 years and she was already 109 kgs. That is even wrong. That is even, you know, that no, 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 no. That is hard. So you will need to help, because even the child who is there's another conversation we will have. There's another conversation we'll have some other day. There's someone who says, I was born chubby. We'll have that conversation later, not now, not today. Not today. Let me just take a sip of my herbal tea as you take yours. And I love my glass. I love my kettle. So even when the child is affected, we also need to assess, because the child can also develop diabetes out of stress. So the same triggers that can happen to a human being when they are older, it can trigger the young child. So why do we assume that children cannot be triggered because of a certain form of stress, certain form, when especially the adolescents, you will find there's so much chemical reaction happening in their bodies. And the insulin is a hormone, and its release and its usage is hormonal. It's very hormonal. So even in that stage, you can find a child has developed that. So then the second type of diabetes is where the diabetes type 2, when you develop as a grown-up. Most people, they'll tell you, I always tell someone, when you are diagnosed with diabetes, I want you to sit back and check between 2 to 5 years from the day you were diagnosed, what had transpired in your life. Most likely you went through something very traumatic, something you didn't know how to handle, something you were not ready for, something the shock absorbers were shocked. Maybe someone died and you didn't expect. Maybe you lost a job. Maybe you lost a marriage. Maybe you lost something. Maybe you lost a child. Maybe things didn't work out as you wanted. Maybe COVID came and it stressed you with anxiety and all these things. So if you're here and you already have been diagnosed with diabetes, the first thing is to identify 2 to 5 years. What are these lifestyle issues that triggered for me to be diabetic? And it can also be some things that happened to you in the past. It can be childhood trauma, unresolved childhood trauma. It can eat and sit and sit and sit and sit, and then one day, boom. It can be unforgiveness. It can be bitterness. It can be anger. It can be those negative emotions you kept inside you at around a certain period of time. I think there's a time, I think last year, when I was doing my meet and greet in different towns, there's one of the towns that I went and a gentleman was brought by the wife. And when we started having this conversation, he was, I think, around 37, 38. And he came because he was diabetic. And we had this conversation about what are the triggers. And he confessed about how he's a teacher and he had been stressed by the principal, stressed to a level that he got diabetes. So even your work environment can trigger. Thank you, Njoki, for reminding me. Yes, I had forgotten the gestational diabetes, which can come during pregnancy. Remember, during pregnancy, it's a whole factory. It's a whole factory reset. During pregnancy, there's so much happening. A human being is being formed in you. So the hormones are moving up and down. Everything is just every system. I always assume that during pregnancy, every system is running up and down. And for some people, after the pregnancy, the diabetes just disappears. Others, it continues. One of the enemies of diabetes is fear. One of the greatest enemies of diabetes is fear and anxiety. The day you walk in and you're told you're pre-diabetic and you start fearing and being anxious about it, trust me, it will develop into diabetes. The greatest enemy of blood pressure, diabetes, the lifestyle diseases, is fear and worry. What happens? They trigger the excess inflammation and it becomes chronic inflammation. And so you give a very beautiful breeding ground for the disease. So if you find yourself, even in pregnancy, when you're told that you're pre-diabetic or you have gestational diabetes, the first, I know as a human being, you might worry, you might get shocked, but always remind yourself you're not the first one, neither are you the last one. There's the positive and the positive. There are people who have been able to reverse, so it's not the end of the world. Lifestyle diseases still our ability to stand firm and to remember our supernatural being, to remember who we are in God, because we fear and we worry. So the type 2 diabetes is mostly affected by the lifestyle, and we have said that if you're already diagnosed, you've already been told, ask yourself what uh, what was the root cause. If it's something you can solve it. Change the lifestyle that caused it. So some of the symptoms that you see, the early stages, we rarely talk about. The early stages of insulin resistance is when you see people who start getting warts, those two small warts around here, the darkening of the neck. They start getting a big double chin, big one. Then this part becomes too big than usual. Belly fat, there's belly fat around. There are some people who lose weight, excess loss of weight. There are some people who will have blurred vision and immediately they will find them not even able to see well. There's some people who will pee a lot or have a struggle with peeing, but mostly they will notice at night, or you just keep peeing. There are some signs, some people, not everyone who experiences all these signs, but some of these signs, they get hungry so easily, and they will eat and not get full. They will eat and they will not get full. They will eat and they will not get full. They keep feeling hungry, because remember that now the glucose that was supposed to be produced into energy, it is being retained in the blood. So that also explains why some people really experience a lot of fatigue. They just feel like, I want to just sleep, I'm just so tired, I'm just so tired. They're always tired because the glucose is not being broken into the energy that you need. So which other symptom? Those who add weight, those who lose weight, about peeing. Uh, which other symptom of diabetes type 2 did I forget? If you remember one, you can remind me on the chat box. And thank you. There's someone who have said here. Yes, Virginia Njoroge, I agree with you. There is no family disease. True. I have been watching families on this, and their diet is actually the cause in most cases. If they got junk food as comfort food as kids, they do the same as grown-ups. Most really gain lots of weight, and eventually diabetes. That is true, Mary. That is very true. So the same way, you see, remember, there is the food is a relationship. Your relationship with food tells me your emotional state. So even the comfort food, the food is not the root cause. The food is not the problem. What emotions are these that we are not dealing with, that we feel we need to cover with comfort food? So as a family, we don't talk about our emotions. Instead, we eat to cover up our emotions. Okay? So the food is not the problem. It's how we take this food to cover up something. So the answer is, the question is, can we go back to the basics? Can we go back to the root cause? There is a tap root, and then the other ones are called what? Something roots. So the tap root is how we handle things. Because the same thing in another family, when they are stressed, they drink alcohol. Okay? So, or when they're happy, they drink alcohol. So the alcohol will go and damage the liver, and the liver will also damage, and the alcohol will also damage the kidneys and the pancreas, and so diabetes will still be in that family, hypertension will be in that family, and so many other things that will be in that family. Um, A family that does not talk about their issues, when you are stressed, you're told to hold things to yourself. You are strong enough. You should not talk about your problems. They will most likely have thyroid problems. When the thyroid is not functioning right, the thyroid is the mother of all the communication. When the thyroid is not functioning right, then there will be miscommunication in hormones. There will be miscommunication. So there will be weight gain. There will be diabetes. There will be hypertension. So we go back again. Let's go back to how, as a family, and even you as a family man or a family woman, how do you guys address things in your family? How do you address things? I've gone to families where they don't talk about things, they sweep things under the carpet. That comes with an effect. I've gone to families where they talk about things, they talk about what hurt, they talk about what that still comes with its own fair share of challenges. Is there a way? Is there a best way? No, there's no best way. The best way is to understand how you deal with things, and then you will be able to know how to handle it. What we spoke about during our first session, that there is no emotion that you can live with forever, and there is no better way of dealing with things. So what we do in my family is maybe is not, it's going to be toxic for your family. Just identify healthy ways of coping with life, and then we survive like that. Yeah, someone has reminded me about the nerves, the protruding small uh, sharp stomachs, especially for men. Yes.
Sharp, sharp. Sorry.
Sharp, sharp stomach, katambi. There are also neuropathies for some people. It starts very early when they start feeling tingling, the numbness and needle like. Those are some of the symptoms of the diabetes. Some of them we didn't even touch on all of them. You realize these things are in my head. I don't even check anywhere, but I had read about, yes, low libido, of course, and especially men, they are the first people to experience this because the diabetes will have, you see, remember when there's a danger in your body, when you have a flu, or even when now what is happening, the breakdown of the sugar is slow, the entire immune system stops whatever they were doing to come and help this side. So the immune system is very smart, and it is busy concentrating on this. So some areas are left not well attended. So the nutrient absorption in your body starts depleting. Even the mood swings, the appetite starts depleting, so that the body, because the body is really trying to heal the pancreas. And so it means that sometimes even the gut will not be able to fully function well, because the breakdown, there is a miscommunication. Even you, when you have a miscommunication in a family, you are not able to fully to fully be at peace. So what do you do? So the recurring yeast infections, yes, those are some of the symptoms, but also those ones, the recurring yeast infections, mostly it comes when now it's already diabetes, when it's already diabetes. So then there is low libido, moodiness. Okay, yes, the mood swings because magnesium is low, low libido because the zinc is low, recurring yeast infection because yeast loves sugar, and there's too much sugar in your blood. It feeds in the sugar. Now, you have already been told you have diabetes. First of all, how do you learn? They have to do several tests. Don't rely on one time that you just walked into a hospital and you did fasting sugars and you're told you're diabetic. No, they can't tell with one. Give it time, give it time, give it time. So when you get to the hospital with these symptoms, they will have to do several tests. And recently, because of technology, there is, like the one that I did here, there's a test. They'll just take your blood, then they'll take it to the lab, and they'll be able to estimate your sugar levels for the last 3 months. So that one is able to tell you, it's able to give you good a guideline on how you are. But that one of today, and then you are told you are diabetic, no. So there are some times when it is too high now and the symptoms are over there, they will do the injections, they'll do something as an emergency to help you lower the sugar levels. That is very okay if they realize it was too high. However, if it is not too high, maybe you're pre-diabetic or maybe you're not exhibiting, there are things now you can be able to go back home and do. I will give the scenario I gave in our other session where you have you have a car, you are driving on the road and it has a problem, and maybe you are on a hill, so you take a stone and you put it behind the tire. This is a story that Dr. Joanne taught me taught me about. Actually, we were talking about diabetes. You take that stone, you hold the car, and then the mechanic will come or someone will come and help you, and you will work on the car. But then when you're driving away, you don't carry when you're driving away, you don't carry the stone. So what we do is when you go to hospital and they go and find it is not so high, there are things that you can go back home and do and start doing. But when it is high and they have administered the emergency cases, and maybe 1 to 2 months you choose that is how you're going to lower the blood sugars, you must change the lifestyle. And even if you were put on medication and you went back home to the same toxicity, you went home back to the same diet, you went back home to the same lack of exercise, you went back to the same weight, you will be doing a lot of zero work. The medication will be doing a lot of zero work. So let us not lie that the medication, because I'm on tablets for diabetes, that I'm on insulin, that I don't have to work to do the inner work. I'm sorry, you have to do the inner work. You have to go back to the emotional state, your mental state. You have to go back to all those things you're keeping in your heart and let them out. You have to really work on who you are. You are really to have to check on your diet. And this is when now I'll explain in simple terms why when you're diabetic or pre-diabetic, you are told to eat whole meal. Whole meal is in its natural state, how God created the rice, how God created the maize, and it was broken down. There is no removal of any parts or no preservatives and additives. So when you're eating, like for example, ugali or kashima, I think in Uganda you call it shima or something, you are eating it as, I'm thinking in Kikuyu, bebea with you, partial meal maize, so they have not removed anything. So why are you advised? First of all, the advice you'll get if you go to someone who is very human, they will tell you when you are diabetic, the first thing you do is reduce or completely remove starches for a certain period of time so that we can reduce the amount of sugar. So the sugar that we're talking about is not the sugar from soda, or just the sugar from the soda, or just the sugar from the tea, or just the sugar from sugar cane or kombucha. We are talking about starches. Just remember starch, the breakdown of starches. Eventually, at the end of it all, it will be glucose or fructose at the end of the breakdown. So when we are talking about the starches, so they are simple sugars, they are simple starches. Those are the refined food, the refined starches, which when you take them, the process of the breakdown, the digestion and the breakdown is very simple and very fast. And so they will spike, the process is fastened. It's like running 100 meters and then someone else is doing marathon. So when you take whole meal, it is like a marathon. So you are processing slowly because of the fiber. It will take slowly, and so it will slowly spike the insulin. But if you do the 100 meters, even your heart, the heartbeat is totally different when you're doing 100 meters and totally different when you're doing a marathon. You have to really engage and practice more, and also use your energy wisely when you're doing marathon. So that is one of the many reasons why we encourage you to first immediately reduce on the starches, feed on the proteins and the vegetables, and to help the body, first of all, reduce the sugar that is accumulated in your blood system. But also, we encourage the vitamins and the proteins because it is a slower and better breakdown. So after the few months, and maybe you have already been able to manage weight, now you slowly introduce the whole meals. And even if you find yourself eating simple starch, you always do small portions and bigger portions of the vitamins, bigger portions of the proteins. Why is it that sometimes you'll also go and be told you have diabetes, but you are told to reduce the red meat? The red meat is acidic in nature. It's yummy on your mouth, but it is acidic in nature, and it is not bad acid because our bodies still need our acidity. But then when we overdo it, it is so when it's acidic, it's a high inflammatory food. So when you eat it in that state, in that fresh state of diabetes, it is going to encourage more inflammation. Remember, for those who are on our WhatsApp channel, I have posted a question before I came for this session, and I asked, what do you think that inflammation is not? Now it seems I will give you an answer. Okay, I'll give you an answer, but then you can go to the WhatsApp channel and just vote, do the poll. So remember, inflammation is a blessing. It's a good thing. It's something that our immune system has and uses to help us heal diseases. It manifests whenever there is a problem, whenever you have a flu, whenever you have an injury, more blood is sent into that space. Whenever like arthritis, when the bones are misbehaving, like right now when you have diabetes, it means the pancreas, there's a problem. So the immune system starts sending more blood to be able to nourish, to heal, to take away the toxins around that area. And so sometimes there is visible swelling, there's pain, there's redness. Those are good things. Those are the good sides of inflammation. So inflammation is good. So when you're told you're diabetic, you are already high inflammation. It is acute inflammation, which is normal good and inflammation. So if you eat highly inflammatory foods like dairy, like wheat, like red meat, at that time, you increase the inflammation and you live in inflammation for longer, which we call the long-term inflammation or the chronic inflammation, which now becomes a problem, which will now affect this other kid. That is how diabetes affects the kidneys, the liver, the eyes, and all these things, because there is chronic inflammation. So when your doctor tells you, or when your nutritionist tells you, reduce on the red meat, reduce on the milk, reduce on the wheat, reduce on the alcohol, do not smoke, it is because they want to prevent the chronic inflammation. So when you are told that don't eat red meat, it is just because they want to reduce the amount of inflammation that there is. Does it mean that you will do that for the rest of your life? No. It means that when the inflammation is lower, you can comfortably and happily eat the right proportion of the red meat. And as a naturopath, you will need to eat meat every once in a while if you choose. But if you are vegan, it is still a choice and it is okay. If you're like me, one of these days, once in a while, I'll miss some nyama choma and I'll eat. The beauty is now, because I know I will not go and sit and eat a whole kg by myself. Instead, I will go and eat a small portion with vegetables and some cayenne pepper, and I'll feel good about it. Okay, because again, if you restrict the brain, you keep releasing the cortisol, the stress hormone. So now I hope you understand why your doctor would tell you to drop and minimize. Immediately you are told you're diabetic, how to reverse this. You understand about the starches, you understand the proteins, vitamins, we keep them as up and as good as possible. And that is where even the herbal teas come, because we need to nourish our bodies with the macro and micronutrients that will be able to help us, one, with digestion, because we know when there's a problem that has been diagnosed in the pancreas, the gut forgets its work. That is where when you are diabetic, you cannot go away from probiotics, because you need to help the gut to do its work. You need to help the gut to do its work. So I have had quite a number of people telling me, can I take kombucha and it is sweet? Yes, by the way, kombucha has sugarcane juice, and it is okay to take kombucha. It is okay to take probiotics. It's okay to take probiotics. At the hour you take is what determines. If you take kombucha on an empty stomach, it might spike the insulin. If you take kombucha a whole bottle, it can, if you're already diabetic. And that is why it comes, we teach at IFNHP, and every person at R&B, the ones that I told to write on the comment section where their shops are, every person who sells to you products from R&B has to go through the 12 weeks program at IFNHP. So we don't just sell, because we need to teach you, to tell you, please don't hear that kombucha helps diabetics and go and buy and then start drinking without knowledge. So the best time to take kombucha when you're diabetic is after you have already eaten a meal. It's like 30 minutes to 1 hour. You take your glass, or in the morning during breakfast, you mix it with something like sea moss and you take it happily so that the gut can work well. So there are some people who are affected by diabetes by their muscles. The muscles start eating themselves. My English is over. How can muscles eat themselves? Yes, you get what I'm talking about. So there are those people whose muscles start degenerating. And so that is where now, when you get such a case, you help them with collagen to help them rebuild the muscles. You help them with CMOS to help them rebuild the muscles. So this is what is happening, is there is a disaster happening. It's like when you're told you are diabetic or hypertensive or whatever, it's just like what happened when we got COVID. We were living normal lives, and then boom, there's something that has happened. What did we do? Did we start? Of course, there are those of us who really freaked out. Oh, we don't know what to do. Of course, because of that is how life is. Some people died, and may they rest in peace. But then we who survived it did not. We only adjusted to the lifestyle that it came with. That is the same approach we should have about a disease. It has come. Do I worry to a point it kills me? Or do I adjust like I adjusted during COVID? I wore my mask. I washed my hands throughout. I did a lot of ginger and lemon and such things, and I helped my immune system. Or will I sit there and say, oh, it is time to die. Oh, I don't know. Oh, I will not eat well. La, 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 la. You see the perspective. That is what I'm talking about. So now that you understand why the diet restrictions, why the sudden diet restrictions, and after you are able to manage, after like 6 months to 1 year, you can be able to eat anything and everything you desire in the right proportion and at the right time. Because if you're diabetic and then you decide to take a fruit in the morning on an empty stomach, do you expect that the insulin will go up? But then if you're diabetic and then you get hungry, and I was also having this conversation with Dr. Joanne, how now Dr. Joanne, I love talking to her because she will use the medical terms. Hyperglycemia, hypoglycemia, yes, those ones. Anyway, how when you're diabetic and then you always carry your apple, and then when you feel hungry, you eat the whole apple, the whole apple, the whole apple when you're hungry. Instead, carry nuts that are fibrous, carry nuts that are not high in terms of sugar. In your bag, put a carrot, put something else. It's not I have a problem with apples, but if you take a whole apple when you're hungry and you're diabetic, you're not doing yourself justice. Then if you're diabetic and you carry the milk is highly inflammatory. So when you get hungry, you eat, you drink the milk, then you're not doing your body justice. So I want to show you a book which I will post on the WhatsApp group, which you can learn on what to eat. This book has really helped me. If you're diabetic and you already are diabetic and you want to know, or you have someone you're taking care of, you want to know what they can eat when they're hungry and how to do it, This is a book by Jennifer Roberts. I'll take a photo. Then there's this one, The Food Mood Connection. The Food Mood Connection. Then there is this one, Life Without Diabetes. At least they've given you some nuggets on and some snacks, some ideas on snacks, some ideas on which snacks you can take if you're already diabetic. And like this one has a lot. I've really highlighted so many places because it has a lot of small details on fats, on starches, the things that a nutritionist teaches you. This is a lady whose husband was diagnosed with diabetes, but every information they were getting was so confusing. They ended up doing their own research and writing their own books. And sometimes the information out there is, I'm looking this side because this is my library. I want to see which other book I have for diabetes. I think Wendy Greens. I also have another one for Wendy Greens, but I can't seem to find it. After this session, I will post the books on the WhatsApp group, and you can go and buy the books. They are also online. You can also learn. Please let us invest in reading, Bana. Even if you don't want to read books like me, you can do research. You can do your research. So invest in learning as much as possible. So you are already now diabetic. You've been told that you're pre-diabetic, and we have talked about the diet. This is also when now you move. Why do you need to move? To do some exercises. One, we need to burn the excess fats. Number two, we need to open up the circulatory system and the lymphatic system so that the systems can go back to normal. Number four, we also need to do exercises. When we have already been told that we are diabetic, we need to do the exercises to help remove the toxins that are in our system. So exercises is not just for weight. Even you who is losing weight, and because you're diabetic, you need to exercise so that you can help remove the toxins. Another secret I'll give to someone who is already diabetic and who would want to help remove the toxins from the body is indulging in cold or hot therapies. Cold or hot therapies like sauna, steam bath, jacuzzi, ice bath, hydrotherapy. If you can come to our R&B spa, we have the massage. You can also do the massage therapy. It also helps with the lymphatic system, lymphatic drainage. So you can do the massages, you can do the sauna, you can go to steam bath, you can do the hydrotherapy. At R&B Spa, we have a hydrotherapy and aromatherapy, and you are welcome to come and join. So if you're in a country that has ice, you can try once in a while. Step outside for 1 minute barefoot. 1 minute barefoot, and then go back to the house and shower. Also learn about, I think on my YouTube channel, I know on my YouTube channel, I have a very small video on draining the lymphatic system, something that me and you should do to prevent lymphatic cloggage. So you can have dry brushing. If you want to know about dry brushing, go to my YouTube channel, Caro, your health coach. Drink water, drink green tea. Green tea is really good in helping the drainage of the lymphatic system. Those people who have water retention in their feet and in their bodies, they need to take plenty of water because you need to pee a lot. Not a lot, you need to pee and you need to sweat so that you can be able to help remove those toxins. Of course, if you're already diabetic, you have to make time to rest. Why rest? Rest helps the immune system. It just helps the immune system to be strong enough to be able to do its work. So if you're not resting, then how will the immune system be able to work? So rest is very key. And of course, now we have to assess the mental and the emotional state. If you got there because someone annoyed you, and you can't forgive them, go to your God, go to your supernatural being and tell them, I'm here because I cannot be able to forgive so and so. Please help me how to forgive. Just teach me how to forgive, because forgiveness, I know it's not easy. Forgiveness is not a one-day thing. Forgiveness, there's a way I've summarized. Let me read for you what I've summarized in this book. And if you don't have this book, you need to have it. It's a small book you read overnight. Let me try and summarize for you what I summarized forgiveness as. Bye. When I need it is when it's disappearing. Aha, here. Okay. Okay, I had given stories, but just ignore the stories I had given before and just listen to this. What am I saying? Sometimes the greatest inspiration comes from that person or that occurrence that you refuse to forgive. Always ask God for the grace to forgive and learn from it. For you to be able to live fully in God's purpose, you must seek His grace to forgive and love, especially your enemies and all those who do wrong to you. This is a lesson I have learned the hard way. Does that mean you are doormat? Kindly mute the mic. Does forgiveness mean that you are a doormat? No. In his book, Dare to Forgive, there's a book called Dare to Forgive written by Edward M. Hallowell. He identifies 9 types of forgiveness as follows. 1, you have been wronged. The other person apologizes and seeks forgiveness from you. 2, you have been wronged. The other person does not acknowledge the wrongful act and does not seek forgiveness. 3, you have been wronged. You do not know who did it. You don't know who to blame or whom you might forgive. 4, you have been wronged. You acknowledge what you have done wrong. You acknowledge what you have done and you seek forgiveness from others or from yourself. 5, you have done wrong. You justify what you have done and do not seek forgiveness. 6, you have done wrong. You acknowledge to yourself that you have done wrong, but you do not dare to tell anyone or seek forgiveness. 7, wrong has been done. All parties justify what they have done. No one seeks forgiveness. 8, wrong has been done. Some people on both sides acknowledge responsibility and seek forgiveness while others do not. 9, wrong has been done. It was an act of fate. No one is to blame, but some people feel guilty and seek forgiveness while others feel angry and seek revenge. COVID came. Some people felt guilty and went to God to apologize and to say sorry. And then others felt angry and sought revenge. So what am I saying? What I believe as Carol is that whatever category that issue that you're dealing with that needs forgiveness falls, it is your responsibility to forgive. I still think the hardest person to forgive is yourself. Oh, Lord knows that I have said or done things I regret to date. But by God's grace, I have learned to forgive myself because each time I refuse to forgive myself, I justified why I do not deserve forgiveness from God, from others, and from myself. Therefore, I deny myself a chance to receive kindness and compassion from God, self, and others. I become an obstacle of my own purpose. God promised to forgive all our sins and forget them. Who am I to constantly remind him, myself, or others of the wrongdoings I did or I said? Forgiveness does not mean you will automatically forget. No, we are human. It is only by God's grace that we are able to forget. And I assure you from my personal experience that God can and will give you a selective amnesia if you ask him to help you forget after you forgive. Sometimes someone will remind me of a wrongdoing they did, and because I forgave and asked God to help me forget, I cannot seem to remember what they did or what they said. You know why I chose the path of asking God to help me forget the pain and the act or inaction or the words that had caused me harm? I also actively pray that the other person I wronged may forget, but I have no way of knowing. Sitakusomea yote. Get this book. I have spoken a lot on forgiveness. A lot on forgiveness. And I have shared my personal examples. What am I saying? And why am I insisting on forgiveness and bitterness? Because there is a very high percentage that proves that diabetes loves people who don't forgive, loves people who carry bitterness. Oh, this is a tough conversation. Diabetes thrives in hearts that are carrying a lot of anger. Yes, I know. Diabetes itself, and sometimes the medication depletes magnesium, which is the nutrient that keeps you calm. It depletes dopamine. It depletes serotonin. Yes, I agree with that. But you can also choose to be happy. So it has already happened. You are there. It is in the early stages. You can be able to reverse. Well for you, good for you. We have the herbal teas, we have the whole packages for diabetes, and that is why I was telling my team to write down where they are located and their phone numbers, so that if you have a question, you can reach out to them. They will be able to teach you. But the herbal teas and the medication, they don't work if you don't work on it. Now you are there. You were diagnosed a long time ago. You have been on medication for quite a period of time. Am I telling you to drop the medication? No, it's not my business to tell you when to drop the medication. But I just want to remind you that everything comes with its own consequences. So it has been, and this you can go and ask your doctor. If the medication you're taking comes with other side effects, if you take them for too long, this one you go and ask your doctor. If they are human enough, they will tell you. Or take the medication that you're taking for diabetes and read the paper that is inside there. And you will see, if you take for long, what happens to your body. This is a very scary conversation, because the message out there has been different. It has been phrased differently, that if you ever drop that medication, you will die. If you don't do this, you will die. But whichever way, it's a choice. I told you I'm a coach. Mine is to show you. And then you choose whether to run, whether to hide, whether to change the lifestyle, whether to do something. Now you're seated there and you're watching me and you're listening to me, but you're not diabetic. In your family, there is actually no diabetes, and you think you're clean and you feel, oh, you know what? What are you going to do? How can we prevent? And even if it ever finds us, it will come and find a body that will be strong enough to fight it. Because that does not guarantee that you will not have diabetes. It can come. Who knows? Maybe tomorrow you'll find something that will shock you to the core. Maybe you'll go and eat some medication or drink some medication that will come and cause that. Who knows? And by the way, lifestyle diseases are not diseases of old age. I've seen quite a number of people who believe in old age they must be sick. No, God intended for us to be age gracefully and happily. So let's stop calling diseases in our old age. Hallelujah. There are people who are waiting to be 50 so that they can have diabetes. There's a friend of mine who made me laugh the other day. She told me her mother was diagnosed with diabetes, and her grandmother is alive. So when her mother called her grandmother and told her, "Hey, mommy, I've been told I have diabetes," and the grandmother said, "Even yours is a bit late. I was expecting you will have it earlier," because the grandmother now was explaining to this girl's mother, "You know, these diseases, they come as early as 50. So be ready." I mean, I was even wondering why yours has stayed that long. That is the mentality we have, that that when you hit 60, you must be sick. It's not true. You don't have to be sick. I'm watching beautiful men and women in their 70s who have no ailment. I am watching, the younger people here who watch Netflix. Have you guys watched Beauty and Black? It is trending. Beauty and Black is trending. Have you seen this very handsome guy called Horace? He's acting Horace. Oh my God, that man is handsome. Hey! And he's 63. Okay. So now back to serious business. Yeah, Horace is very handsome. And he's 63. Oh, kumbe you guys are listening. You're in class, eh? Kumbe, I see. There are people in class. I thought I was alone, so I needed to know whether you're in class. But you guys have seen that man. He's 63. He's doing like 20. He's doing like 50 press ups. And he has these 6 packs, and I'm like, Jesus. Huh? Anywho, so you don't have to age. You don't have to, because you're aging, you to be sick. No, you don't have to. You don't have to, my darling. So don't, even your tongue, the power of the tongue, stop calling these diseases. Stop saying these things. Stop calling you the arthritis. Later we will do an intertwine of why people see diabetes, hypertension, and arthritis as if they are sisters. Later we will do that session. Okay? So please, let us just, what can we do? Like for me, what I do, I invest, I take herbal teas, my probiotic every day, my CMOS gel, which is mixed with some collagen. And I told you, for free. If right now I'm doing this from my house, you can tell this is my house. If you came to my house right now, what I'm teaching you is what you'd find. You'll find me with my herbal teas. You'll find me with kombucha. You'll find me with my CMOS. You will rarely ever. But then in my house, we don't even have that thing that you used to make chapati. What is it called? That rolling pin. But then I looked and I was like, oh my God, we don't even own a rolling pin. That's how we despise chapatis in my house. This is a choice that I've made. And now, last year, God proved to me, and He keeps proving to me. And I can't tell you, this time I went to this hospital, it's not because I was feeling anything. I can't tell you the last time I ever felt pain. And if I felt pain, it is because of an emotional thing. So what do? I go to the spa. We have this conversation with Susan. I was in the spa on Saturday, and we will have this. After I do the hydrotherapy, we'll go to the massage table. Even Susan can tell when I am emotional. Like anytime I'm grieving, anytime you see, grief never ends. It will keep coming and going. Anytime I'm grieving my dad, the below the knees, they are so painful. Below the knees, what is that, Nyama? It's called maskwembe. I don't know. Someone tell me where maskwembe is. What maskwembe is in English. That part it really swells and it gets painful. When I'm stressed about my man, my body aches. When I'm carrying the whole company and when I don't know what, my back aches. When I've sat for so long, when I've traveled for long. So your body is telling you, that's not a disease. Those are symptoms of what your body is telling you to do. When I've not rested enough, my body will misbehave, my skin will change. So just choose this and it will help you prevent diseases from you. I want to conclude this session because even my throat has said no. You're already in there, you want the package for diabetes. On the comments on the chat box, there are details for my R&B team. Reach them out or visit our shops. Our headquarters is in Thika Town, Magoko Road, just before Chania Tourist Lodge. We have Nairobi Town, we have Nanyuki Town, Nakuru Town. Oh, my biceps, maskwembe, yes, they are called biceps. I think my mind has just, maskwembe. So you can visit any of our shops. Don't feel bad when they ask you deeper questions. Some people go there when you're asked deeper question on when were you diagnosed, what medication are you on, how is your heart, you get so angry. Why do you get angry when you're questioned? It's not that we are getting into your personal life. It's just because we need to understand where you are at so that we can be able to help you. Because remember, even these herbs are not for healing. Herbs are foods. So you don't eat them when you are sick. You eat them every day as your food. So there's someone who asks me, what heals? What heals? I'm like, it doesn't heal. It helps. It accelerates the immune system to be able to do its work. So make it a day-to-day life. Don't wait until when you are sick for you to be able to take probiotics, for you to be able to take herbal teas, for you to eat food, for you to think before you eat. So the next time you're going to a restaurant, the next time you're home and you ask, what are we making for dinner? Don't cook ugali because there is flour. Cook because you know the nutrients that you need. My sisters and my brothers from Uganda, hi, how are you? I love you so much. Your foods are really good because they are natural, but be careful not to overdo the starches. And when you do the starches, because every time I visit, I find on my plate, I'll find matoke, I'll find sweet potato, I'll find ugali, which we call ugali. I'll find some pumpkin. It is well prepared, by the way. Shakazulu. The last time I was in Kampala, Salome took me to Shakazulu, and I liked how it is steamed. It is not fried. That is really good. But as a person who has attended this session, just reduce on the starches a bit. Don't do so many of them at the same time. But I love the way you prepare your food with less frying and all those things. However, you can take in smaller portions when they are you take more starches in smaller portions. Peanut sauce is really good, but when it is taken for so long, the bad high cholesterol. Now, like I see people struggling with the bad high cholesterol, and I feel sad. And indigenous tea mixed with purple tea, taken faithfully for 2 weeks, your blood, the bad cholesterol will not be there. So God has provided us with all these things. And even that diabetes, it is reversible. However, when it gets to another stage where the inflammation is so long-term, so chronic, it has already damaged the kidneys, it has already damaged the heart, the nerves, I am not able to do much. In Kikuyu, we say muteoroga wawe munini. And in Hannah, you seem to get it. Right for me, Muteoroga wawemunini, what that means. The tree is corrected when it is young. Yeah, something like that. So it is very difficult for me to change the course for a tree when it has already really, really gotten the roots. So we work with prevention. Prevention medicine is better than management. Any questions? Any comments? We have how many minutes? 5 minutes? Yes, around 8 minutes. Any question, any comment? Let me see the chat box, what is there?
Hello.
Kristen, you've seen Horace, he's handsome. Yes, he is.
Hello.
Let me see who is talking. This is Harriet. Hi, Harriet.
Hello, Carol.
How are you?
I'm good. How are you?
You went back home well?
Yes. I arrived on Saturday at night.
Okay.
Yeah.
Okay.
Yeah. Thank you so much for the session. I would like you to advise me on the specific tea for someone with diabetes. The herbal tea.
Herbal tea. So the best, there is no one that I have put together, but if you give them indigenous tea mixed with guava tea and chembabita, they take 5 cups a day, then their body will be happy. But then once a day, they take anti-inflammatory tea. Once a day, just a cup, just 1 glass of anti-inflammatory tea. Then during the day, the whole day, let them purpose to take 5 to 8 cups of indigenous tea mixed with guava tea and mixed with chembabita, those 3. And then observe the other lifestyle things that we have talked about. And if it's a man, you will need to add something for the zinc, because I'm sure their libido has already gone down. Chembabita is chembabita. It's English. Actually, chembabita is in English. I wish you came for the farm tour. I should. That's why we host farm tours, to show you these plants. It's a wild plant. So Harriet, I hope you've taken notes that you can give them during the day up until maybe around 6, because again, we don't want to overwhelm the bladder in the evening because of diabetes. So during the day, from morning to evening, you can purpose to give them 5 to 8 cups of indigenous tea mixed with guava leaves tea and chembabita plant, so that you can mix them. This is my kettle. Let me show you. Oh, this is a different one. Oh my. It needs to be emptied. But my teas are here. So here I have mixed them. You can mix these teas. The 3 of them, you can mix them. You just do a handful, the 3 of them. Then during the day, you give them one cup of anti-inflammatory tea. Okay, any other question?
Thank you so much.
Karibu sana. And the next time we call for farm tours, guys, come, learn. Harriet, maybe before you go, you can tell them what you learned. You came all the way from Uganda for the farm tour.
Oh, Carol, it was fantastic. That's what I can say, because I saw all these herbs, and some of them I see them along the roadside. I could not believe my eyes, but now I've learned. I've learned, and how you said it, you said you just put in water. You're not in hot water. You don't have even to boil. You
Yes.
boil the water is ready. You put your leaf in the cup and pour the water, and you take, and that is it. So I was so happy.
That is
Thank you.
true. That's it. Most welcome. I know even Mary. If Mary is here, Mary, did you manage to come for this session? She was in our other session. She came all the way from Germany for the farm tour this year. Was it last year or this year? This year, and we thank God for such commitment. Thank you so much. Anyone else who would want? I showed you the books. Yeah, I'll take the photo. I'll take a photo of the books that you can get more details, because I have only touched on top. So I'll share the photos of the books, and you can get the books. For me, I buy my books at Textbook Center. But also, sometimes you're just passing, you will see the books. I also have a beautiful, beautiful, amazing friend who keeps buying me books from the US and sends me. So I have so many books. I have so many books. And if you want to gift me, you can gift me a book. Thank you so much. God bless you for choosing to bless me with a book. Okay, let me see. Chamber Bita. Mercy Mugisha. Are you on the WhatsApp group? I'll send a photo of Chamber Beta if you're on the WhatsApp group. It's called Chamber Beta, but also we have it. R&B has it in as it's dried. Just curious. I've been researching ketosis, and and I recently did 100. 100, yay, Faith. I'm not diabetic myself, but I was wondering if something like that could. Yes, actually, fasting helps diabetes. But most people are scared because they say, I am losing energy, so I might collapse. Actually, fasting reverses diabetes. Would you consider doing ebook? They may be. Be easy to access than hard copies. No, they're not my books, Liz. These are the books that I've been reading over the years. I have actually done an ebook for diabetes, but I'm yet to publish it. I've done a whole ebook for diabetes because it has worked wonders for some people. The same as Mimosa pudica, is it? Annie, there's a question there. Is Chamber Bitter the same as Mimosa pudica? Annie is the one who knows botanical names. Thank you, my teacher, Margaret Wambui. Thank you, my teacher, upcoming graduate here. And yes, diabetes is reversible, especially in early stages. I have seen my dad embracing the herbal teas, working on himself and reducing the sugars. I am happy with the progress. You guys, send some emojis for Margaret Wambui. Send some emojis for her dad. Thank you so much for sharing that her father has actually embraced, and there's a difference. And also, she's coming to graduate. Yay! Thank you so much, Margaret, for sharing that. So Mercy Mugisa, what you do is you will text Annie after this, and she will add you and anyone else who wants to be added to the WhatsApp group. We also have a WhatsApp channel for Carol, your health coach, where we post a notification, where we post and share. And if you are here and you're on the WhatsApp channel, the trivia today was on inflammation. Go and show them that you know what inflammation is because you attended this class. Amazing, amazing. I'm just so passionate. I love what I do. I feel like I can do this for the rest of the whole day. I'm so tired, but I feel like I can do it the whole day. I'm so happy that you came. I'm happy that you are part of this. I'm happy that you have given me the honors. I'm happy that you have sent me emojis. Yeah, please make me happy. Send me those emojis. They make me really happy. Recently there's a WhatsApp status I saw somewhere on TikTok. And this is my last story because I can tell you stories. Thank you for the emojis. Of a guy who said how he feels jealous, how he's currently jealous of his nephews and nieces when he sees the kind of toys that they have these days. And he said, but he remembered that he's an adult and he has money. So he now buys himself some toys. And he was very happy because of a toy that he had bought of an octopus. So it's because you're an adult doesn't mean that life should be boring. If something makes you happy, Ebu, you be happy. If buying a toy will make you happy, please be happy. If those emojis are making me happy, please just make me happy. If you like Horace, if you have a crush on Horace like I do, it's okay, it's easy. Don't take life so seriously. Let's relax, let's enjoy life, let's live as if we are living. Some of us are surviving and waiting to die. Oh, Christine, we are together. Yeah, so like even after this, the way I will rejuvenate, I'll just go to Netflix and just see Horace for one time and just feel good. I love you guys. Nawapenda sana. Thank you so much. Remember, this was our last episode for 2025, last webinar for 2025. I hope to see you during our graduation. You are invited, whether you are graduating, whether you are friends, because you've become a part and parcel of us. Please come for that graduation and see what happens at IFNHP when people will be celebrating to be naturopathic and functional healthy life ambassadors, certified and accredited by the Association of Functional and Naturopathic Health Practitioners. So karibu sana. Annie will share the details. If you're not a part of our WhatsApp group, feel welcome. The WhatsApp group reminds us and tells us when the next webinar will be, and we also suggest the topics we would want us to talk. As always, it is my joy. It is my joy. It is my joy. Thank you so much. Follow me on Facebook, Carol Your Health Coach, on Instagram, Carol Your Health Coach, on my YouTube, Carol Your Health Coach, and on TikTok, Carol Your Health Coach _KE. Remember to hydrate, remember to smile, remember to be happy, and let's get healthy and stay healthy with Carol, your health coach. Mwah! Let me read these beautiful messages. You can let me see if I can do the emojis because I'm happy. Oh, I can't send emojis. Yeah, I have done it. Now I'm learning how to do this. So thank you so much. Thank you so much, Betty. Thank you, Lydia. I appreciate meeting you. Asante Agnes Gidinji. Thank you so much, Christine. Thank you. Ati, Brianna, you're going to throw away the rolling pin. Yes, please go throw it away in the pan and forget about chapatis and mandazis and do the gluten-free ones. All right, Sawa, let's say, Annie, is there anything you'd like to say before we close with the grace?
I see someone asking whether kefir is a probiotic.
Yes, it is.
Yes, and for the person who asked whether there is njoki, no, Chambabita is not Mimosa pudica. Chambabita scientific name is, it's very hard to pronounce though. Philanthus urinaria. I'll send on the group. That's the scientific name for Chambabita.
Yes, and Chambabita is also called kidney stone breaker. It has so many names. It has so many different names. But when you see it, now you can be able to go and look for it. Thank you so much, Annie. We appreciate you because you have been organizing these webinars. I challenged you and you took the dare and you have really grown. I'm very proud of you. Oh, I'm very happy. Kwani nimekunywa nini? I'm feeling so excited.
Was she see Netflix?
Horace. Yeah, I've just remembered it's Horace. Thank you. Thank you. We appreciate you and pass our regards to Milka as well. I know you work together. And everyone who is coming for graduation, we can't wait to see you.
Yes. I don't have anything else to say, but thank you guys for the time and even for staying up to this hour. We are very humbled. We appreciate you. We love you. And may God bless you. And I know even if we ask you for another time, you're going to show up. And for that, may God always bless you. Have a lovely evening until we see each other again.
Yes. So we say the grace.
And may the grace
of our Lord Jesus Christ,
the love
the love of
of
God,
God, the Holy Spirit,
and
and
the worship of the
bless
Holy
now
Spirit be with
and
us
forevermore.
now.
Amen.
Amen. Amen. Bye-bye.
Amen.
Bye.
Bye-bye.
Bye. Bye,
Bye.
Carol.
Bye.
Bye, Carol.
See you.